Patients with thyroid eye disease come in with a whole host of problems. And that's why we developed the center here. They come in with problems with their thyroid function. They come in with double vision, with protrusion of the eyes, with burning, pain. So there's never one solution that is perfect for everyone. Instead, it's much more important to offer a customized or personalized solution. And that can be anywhere from making sure that their thyroid is well regulated and controlled, to offering them reconstructive surgery that can restore their lives and give them back their appearance and their function, which they've lost through the course of this disease.
So the lucky part about being at the University of Michigan is that we're surrounded by a research institution. And whenever anything comes up in medicine and ophthalmology, we're going to be the first ones doing it. We're going to be the first ones inventing it. We're going to be the first ones trying it. And we're able to offer that to our patients. Our thyroid eye disease program here is world-renowned. We have patients throughout the world coming to our thyroid eye disease program, mainly because we have doctors in every specialty focused on the patient here working together. There's physicians in oculoplastics, neuro-ophthalmology, pediatric ophthalmology, adult strabismus. There are endocrinologists that are working on the patient, and a multitude of other doctors that are involved in the care of the patient. We all talk to each other. We have a monthly thyroid meeting where we can discuss our complex patients and ask for suggestions or help as we're doing that.
The goal of the multidisciplinary approach is to have the patient make as few trips as possible to Kellogg, because most of them are out of town, out of state, out of the country. Our ability to have them see multiple doctors within a couple days of each other can really streamline the process for them.
The multidisciplinary approach to thyroid eye disease is unique to the University of Michigan, and I think it's quite an important aspect of how we provide care to our thyroid eye disease patients. The name thyroid eye disease is a bit misleading because it implies that really all that there is to it is thyroid stuff and eye stuff. But in reality, it's a disease that affects the entire body and really affects the entire life of the patient who suffers with it. So, when we take care of a thyroid eye disease patient, we include an endocrinologist, a rheumatologist, an endocrine surgeon, and ancillary staff to really try to understand where the patient is coming from as an entire human being. The disease can be extremely disfiguring. It can have a lot of functional implications where people have double vision, they're unable to drive, they lose their independence, and they don't recognize themselves when they look in the mirror. And so understanding all of those different facets of the condition is crucial in order to providing appropriate care.
In order to address the eyes, we also need to address the body. We also know that Graves' disease affects patients emotionally. And in order to take care of the patient in totality, we need to address that as well. The ups and downs of the hormones and the treatments and the reconstructive surgeries can really take a toll. Here at the University of Michigan, we are fortunate to have a group of very dedicated surgeons and physicians and scientists who work together, both to treat patients today as well as change the way that patients will be treated in the future.
The patients are very happy with this multidisciplinary approach. It really helps them with coordination with their jobs, with their family. They can have everything done within a few days and get some answers they need to move forward.
The philosophy of our program is that we want to offer state-of-the-art, customized or personalized care to patients, and to as many patients as possible, because we feel that the integration of this multidisciplinary care is really the key. We've been very fortunate to be able to provide this care on a much larger scale due to a donor and several other donors that have contributed to this process. And hopefully in the future we'll be able to allow patients who weren't able to receive care to now embark upon this journey also.